Hello, SUN-DAC caregivers. Welcome to Understanding Mental Health in Youth with Disabilities. For this talk, we'll be going through this in 3 separate segments. First, we'll go through the introduction to comorbidity, explaining what comorbidity is. And then our second segment will go through what are the signs and symptoms to look out for. And then our last segment, we'll go through the tips and resources for you, the caregivers. Right, let's get started by understanding what are comorbidities. So, what is comorbidity? Comorbidity happens when there are 2 disorders or more present, which results in more serious symptoms. These disorders can either be physical or psychological disorders. As you can see here, one example of psychological disorder would be intellectual disability and obsessive compulsive disorder. But it can also be a combination of both, such as intellectual disability, which is a psychological condition, and a physical condition such as epilepsy. For the purpose of this talk, we will only be focusing on psychological comorbidities. In order to help us understand better, let's start by asking ourselves one simple question. What are psychological disorders? Psychological disorders refers to a condition when there are distressing, stressful, or maybe unusual thoughts, feelings, and behaviors present in a person. The presence of these psychological disorders can affect both the person's daily functioning as well as their quality of life. Caregivers are in turn impacted as well, as they have to manage the challenging behaviors as a result of these psychological disorders. Intellectual disability affects a person's functioning in everyday life. While persons with intellectual disability or autism do experience the same type of psychological disorders as people in the general population, the risk of a comorbid psychological disorder is greater for people with intellectual disability or autism. There are also more reports of challenging behaviors and emotional regulation difficulties for people with intellectual disability or autism. Now you might find yourself wondering, what are some of the possible reasons for the higher comorbidity risk in persons with intellectual disability or autism? One of the possible reasons for higher risk of comorbidity is problem-solving skills. Problem-solving skill is a cognitive process where a person considers the situation and possible solutions depending on the pros and cons. People with intellectual disability and autism often demonstrate poorer problem-solving skills due to lower cognitive levels, where they may experience difficulties in reasoning, inflexible thinking, and difficulties in understanding perspective from others. They may also find difficulties in planning. This in turn results in them experiencing higher levels of frustration and anxiety, and they require support from others to help them calm down and regulate in a safe manner. Another possible reason for higher risk of comorbidity could be biological. The risk of comorbidity in people with intellectual disability or autism may increase as people with intellectual disability or autism are more vulnerable to specific comorbidities. Some of the psychological disorders have a genetic factor where the risk of it is higher, as there's a close relative with the same psychological disorder. Additionally, some disabilities with a genetic cause may also increase the risk of certain mental illnesses. Just to provide you with an example, a common comorbidity would include intellectual disability and Down syndrome. A person with Down syndrome also has increased risk of developing dementia. People with intellectual disabilities or autism are observed to have less social support, such as less friends and only have immediate family as compared to the general population. They may also have less opportunities to develop important social roles that can contribute to their own self-worth and self-esteem. There's also a higher chance of them experiencing negative social interactions with others, such as being isolated, rejected, or bullied. This may hence result in them having a negative social image, which in turn affects their emotions. Finally, lifestyle factors such as having an unhealthy diet, inadequate nutrition, A more sedentary lifestyle and poor sleep routine may also lead to higher risk of poor physical and psychological health. People with intellectual disability or autism are also reported to have lower levels of participation in different activities in general. They may spend large portions of their time not meaningfully engaged in structured activities. This also will result in poorer psychological health. Now that you have a better understanding of comorbidity, what are some of the difficulties in identifying comorbidity? People with intellectual disability or autism experience communication difficulties where they have difficulties expressing their thoughts and feelings. Thus, others will not know how they feel or what they are upset about, and they would have to interpret based on the presented behavior of the person. There is also something known as diagnostic overshadowing. This happens when people assume that the symptoms of a psychological disorder is due to their intellectual disability or autism. This occurs especially when a mental health professional does not know the person with intellectual disability or autism well enough, and this results in the psychological disorder going undiagnosed and untreated. Thus, it's important for you as a caregiver to observe, to speak up, and to inform the mental health professional that these symptoms are not typical behaviors and they are something new entirely. There are also differences in how symptoms are presented. People with mild intellectual disability or autism may display similar symptoms to the general population. They can communicate others about their feelings or thoughts. However, this will be significantly harder for people with severe intellectual disability or autism. Usually, symptoms are only picked up when people with intellectual disability or autism exhibit behaviors that are of a concern to caregivers. We have come to the end of part 1. Thank you.